Here I'm going to talk about the pharmacology, what is very important for NCLEX board exam. Due to some unknown reason, the NCLEX licensing exam like to ask the question from here. First one is called monoamine oxide inhibitor, shortly called MAOI. So that are the used for antidepressant. So monoamine is used for depression, and there are three major drugs called Parnet, Marfen, and Nardil. So it is the brand name, right? So how we can remember it? Easy way to remember monoamine oxide inhibitor. Think of Panama. PA stand for Parnet, and NA for Nardil, and MA for Marfen. So brand name is Marfen, but real name is isocarboxide. What next? Next is here autonomic dysreflexia. What is autonomic dysreflexia? So it is a syndrome in which there is a sudden onset of excessive high blood pressure, and it is more common in person with a spinal cord injuries, and that is involved the thoracic nerve of the spine or above the T6 or above. The potentially the life-threatening emergencies. So if a patient comes with autonomic dysreflexia, patient position is important. Head of the bed should be 90 degrees. Also, loosen the constrictive clothing. Assess for bladder distension and bowel infection. Also, administer antihypertensive medication or may cause the stroke, MI, and seizure. So, autonomic dysreflexia, the first sign of autonomic dysreflexia usually are flashing feelings or heavy sweating and headache. Then patient complain anxiety, slow heart rate, blurred of vision, dilated pupil. Next, go. Here, Digoxin. So Digoxin is a cardiac medication. So before give this medication, it is good to check the pulse rate. If pulse rate less than 60, it is good to hold it and notify healthcare provider. Also, the patient who undertaking the digoxin, it is important to check the digoxin levels and potassium levels. Other drugs we use, and that is called Amphozel. Amphozel, actually aluminum hydroxide gel. It is used for treatment of GERD, gastroesophageal reflux disorder, or kidney stones. So this medication is used to treat the symptoms of too much stomach acid, such as stomach upset, heartburn, or acid indigestion. So if my patient have to take amphoxyl or aluminum hydroxide, we need to watch for constipation. It causes constipation. The next drugs here, this one is called Bistril or Bistaril. It used to treat the anxiety and also for the itching. So the generic name is hydroxyzine. So it is used to treat very bad itching caused by allergies. So we should watch for dry mouth, also given pre-operatively. Another drugs we use, and this is called VAST. So this is the most common name is called midazolam tranquilizer, given for concerts sedation. Midazolam or VAST is used in the children before a procedure or anesthesia to cause the drowsiness, and it decreases anxiety and causes the forgetfulness of the surgery or procedure. And it should be used while the child is under the care of a health professional. So watch for respiratory depression or hypotension, because it can cause respiratory depression and hypotension. Other drugs we use is called PTU. PTU means propyl thiouracil, shortly called PTU, or tepazoline. So both of it are an oral medication that is used to manage hyperthyroidism. Like hyperthyroidism means which is due to an overactive thyroid glands. So PTU is an anti-thyroid drugs, right? And like Graves' disease is the most common cause of hyperthyroidism, and we use the PTU. Prevent the thyroid storm as well. Other drugs is called Cinnamate, used for Parkinson. Cinnamate basically combination of the carbidopa and levodopa, right? So dose is the best initiated with 1 tablet of Cinnamate, usually 25 to 100 milligram, and 3 times a day. So sweat, saliva, urine may turn reddish brown occasionally, and they causes the drowsiness. Other medication we use, and this is Artine. So Artine basically used to treat the symptom of Parkinson's disease or involuntary movement due to the side effect of certain psychiatric drugs like antipsychotics such as the chlorpromazine or haloperidol. Sedation is a side effect. The next drugs is called cogentin. The Generic name of cogentin is benzotropine. Treat for Parkinson. Also used for extrapyramidal effect of other antipsychotic drugs. So cogentin or benzotropine is used to treat the symptoms of Parkinson's disease or involuntary movement due to the side effect of certain psychiatric drugs like haloperidol or chlorpromazine. Next drug is called Trigon. So Trigon, the generic name is called trimethobenzamide. So it is used to treat for post-operative nausea and vomiting, and also for nausea associated with gastroenteritis. So Trigon is used to treat nausea and vomiting, as I told, and that may occur after the surgery or with a certain stomach or intestinal problem we call gastroenteritis. Another is called beta blocker, particularly timolol. Timolol we use to the treatment of glaucoma. And glaucoma, a condition where the eye's optic nerve, which is provided information to the brain, and this optic nerve is damaged with or without raise the intraocular pressure. And if the glaucoma is untreated, this will cause gradual vision loss or blindness. So timolol can reduce the intraocular pressure and helps the glaucoma patient. Other drugs is here, and that is Bactrim. Bactrim is an antibiotics, and Bactrim contain a combination of sulfamethoxazole and trimethoprim. And sulfamethoxazole and trimethoprim are the both antibiotics that treat the different type of infection caused by bacteria. And Bactrim is a well-known sulfur-based antibiotics, and that contain many important materials for the skin. And one of its content is the sulfamethoxazole that can help the treatment of acne. So when your patient need to take Bactrim, do not take it allergic to the sulfur drugs. If patients are known to the allergy to sulfur, it is good not to take. Diarrhea is a common side effect. And next is called gout medication. So when uric acid is increased and precipitated in the joint, and patient develop the gout. So for the gout, we use probenecid, colchicine, and allopurinol. So these three drugs is the choice for gout patient. Other drugs is called here hydralazine. Hydralazine used to treat hypertension or chronic heart failure. So hydralazine is used with or without other medication to treat the high blood pressure. So if patient have any sign symptoms flu-like or raise slowly from, it is good to inform healthcare provider. Also educate your patient who take the hydrolazine slowly change the posture from lie down to sitting or sitting to stand up. And it is good to take with food. The next drugs is here is called Bentril. Bentril, the generic name is called dicyclomine. Bentril used to treat the irritable bowel syndrome, or I said dicyclomine is used to treat a certain type of intestinal problem called irritable bowel syndrome. We important to assess for anticholinergic side effect. Other drugs is called Kalan, and generic name is Verapamil. So Verapamil is used to treat high blood pressure, and it is a calcium channel blocker. Also, we can use for angina or paroxysmal supraventricular tachycardia, or anginal pain from vasospasm, or anginal pain is a coronary artery disease. Even we use for unstable angina pectoris. So if my patient need to take calcium channel blocker like Verapamil, the side effect is constipation. So educate your patient, take high fiber containing food and intake of the fluids. The next drugs is here is called Carafate. Carafate, the generic name is sucralfate. And this medication is used to treat and prevent ulcer in the intestine. And it may treat duodenal ulcer, gastric ulcer, and maintenance of healing duodenal ulcer. Coat the ulcer and so take before the food. Other drugs is theophylline. Theophylline is a bronchodilator, right? So they prevent bronchospasm. We use for asthma or COPD. And also, if your patient take theophylline, important to take the drugs level, and therapeutic index is 10 to 20. Mucomist. Mucomist, generic name is acetylcysteine. So it is the antidote to Tylenol and is administered orally. So Mucomist, when inhaled by mouth, acetylcysteine is used to help thin and loosen the mucus in the airway due to the certain lungs disease, such as emphysema, bronchitis, cystic fibrosis, or pneumonia. We use Mucomist. The next drug is called Diamox. The generic name of Diamox are acetazolamide. Acetazolamide we can use for glaucoma or high altitude sickness, and do not take if the allergy to sulfur drugs. So Diamox or acetazolamide is used to prevent and reduce the symptom of altitude sickness, or may treat absence epilepsy, angle close glaucoma, or anorexia due to the high altitude, or may use for edema or epilepsy. Next drug is called Indocin. The generic name of indomethacin. Indomethacin or Indocin is used to relieve the pain, used to reduce the swelling and joint stiffness. And joint stiffness caused by arthritis, gout, or bursitis or tendonitis. So Indocin used for arthritis. Arthritis maybe for osteoarthritis or maybe for rheumatoid arthritis, maybe for gouty arthritis. Even indomethacin may treat for bursitis, tendonitis, means inflammation of the tendon, inflammation of the bursa. Also acute shoulder pain due to the bursitis, it use indomethacin. Acute shoulder pain due to the tendonitis, we use the indomethacin. Or ankylosing spondylitis or dysmenorrhea, even for fever, we use the Indocin. The next drug is here, Synthyroid. Synthyroid treat for hypothyroidism or may take several weeks to take the effect. So it takes time to work. It is important to educate your patient. Also notify the doctor if patient complain the chest pain. And also Synthyroid good to take at the morning, AM, or with empty stomach. Synthyroid can cause hyperthyroidism. The other name of synthyroid or generic name of synthyroid are levothyroxine. Levothyroxine or synthyroid is used to treat underactive thyroid, means hypothyroidism. And side effect is patient can develop hyperthyroidism. Next drug is here, is called Lebrium. Lebrium, the generic name is called diazo or oxide. And Lebrium is used to treat anxiety and also acute alcohol withdrawal. It is also used to relieve the fear and anxiety before surgery. Right? So alcohol withdrawal syndrome, we can use the Lebrium. Do not take alcohol with this. And also very bad nausea and vomiting can occur as a side effect. The next drug is here is called vincristine. The common brand name are Oncovin. So vincristine is used to treat various types of cancer, like leukemia or blood cancer. And it is a cancer chemotherapy that is usually used with other chemotherapy drugs to slow or stop the cancer cell growth. Right? And vincristine is given IV only. So it is anti-neoplastic medication. Next drugs is here. It is called Quail. Quail is this medication we use to treat head or any kind of lice in the body, like pubic lice. So for used to treatment of caries and lice. So in case of the caries, apply the lotion once and leave on for 8 to 12 hours. In case of lice, maybe head lice or pubic lice, use the shampoo and leave on for 4 minutes with the hair uncovered when raised with the warm water and comb with a fine toothed comb. The next drugs is here is called Primarine. Primarine. The generic name is conjugated estrogen. We use for after the menopause. It is estrogen replacement therapy. And this medication is a female hormone. It is used by the women to help to reduce the symptoms of menopause, like hot flush, vaginal dryness, right? And this sign symptom develop caused by the body making less estrogen. The next drugs is here is called Dilantin. The other name of Dilantin is phenytoin. So Dilantin used for seizure. So if your patient take phenytoin or Dilantin, important to check the therapeutic drugs level, and it is 10 to 20. Dilantin or phenytoin is used to prevent and control the seizure. Dilantin, also called anticonvulsant or anti-epileptics drugs. So if your patient have a seizure, if you want to prevent the seizure, we use Dilantin. Or seizure occurring during neurosurgery, we use Dilantin. If patient has a status epilepticus, we can use Dilantin. The next drugs is here is called Nevin. Nevin we use for schizophrenia or schizophrenia. Need to check or assess for extrapyramidal syndrome. Nevin, the generic name is called Digoxin. And Nevin is used to treat certain mental or mood disorder, most commonly for schizophrenia. The next drugs is here. Ritalin, used for ADHD. So this medication is used to treat attention deficit hyperactive disorder, what we call ADHD. A for attention, D for deficit, is for hyperactive disorder. Also, Ritalin we can use for narcoleptic syndrome. So if my patient need to take Ritalin, need to assess for a heart-related side effect, and if we get anything, need to report immediately. Child may need a drug holiday, right? So next drug is here, dopamine. So dopamine we can use to treat the hypotension, or we can use for shock or low cardiac output, or perfusion to the vital organ, right? So if my patient need to take dopamine, it is important to monitor EKG for arrhythmias, or it is important to take the blood pressure, because dopamine is a neurotransmitter and that is produced by the brain of brain cell, or like many neurotransmitter. And dopamine has a several defined function, and it plays a certain role in the function of central nervous system.